So we are a low secure forensic hospital. We have 21 beds. We've been established since 2011. We care for patients from the ages of 18 upwards. It's basically intense intervention for patients with long-standing mental health disorders. Surehaven is located in the northwest of Glasgow, a place called Drumchapel. We have close affiliation with the NHS and local authorities. We do focus on a person-centred care for our patients. We've got a dedicated team ranging from psychiatrists to psychologists, mental health and staff nurses. We also have senior healthcare assistants, occupational therapists, recreational activity coordinators. We're a very sort of small hospital, but we work very closely together, all the departments, to deliver the best care possible. The main aim is to bring people into the service and make sure they have a positive outcome. When we discharge patients from Surehaven, that it's a success story. They go out and they live as independent lives as possible.
The heart of the training is to, give the best training so we can give the best care to our patients, keeping people engaged and up to date with the current evidence so that we can put that into practice for the patients at the end of the day to give them the best care and support that we can to enable them to live the best life that they can. The therapeutic relationship we have with our patients is integral to every part of the care that we have. Patients need to trust you and believe in you, and you need to believe in them and foster hope. People have been in services potentially for a long time and can lose hope at times, so you need to have that positivity that they can get better, they can live in community, because you need to believe that for them just as much as they need to believe that for themselves. We've had a lot of good success here as well. We've been able to see people achieve things like going to uni and doing lots of different courses and achieving things that they or maybe staff and families didn't think was a possibility for them, and they've been able to do that, and not only do that but excel at that as well, and it's been lovely to see. It's been amazing.
There's groups or one-on-one things that we do. There's also sports groups if anybody would like to go. We've got tennis, walking group. Just making sure that they keep with their hobbies and things that they enjoy, that's therapeutic to them, something to look forward to as well. And then if they've had anything, for example, one of our guys had always wanted to do photography, but they've never have access to a camera and stuff like that. So yeah, I feel really lucky because in the OT team, I get to do photography with people, I get to do art, cooking groups and stuff like that. All the stuff that I do really love, but it's got added value with it because you're helping someone gain greater confidence and structure to their lives and stuff like that. So it's really, really good. As you go away feeling like you're double paid sometimes, because it's nice. You have your wee heartwarming things at the end of the day. You're like, oh, that's nice.
It's getting to know them first rather than know the illness first. I like to take everybody kind of face value. Don't get me wrong, it's good to read people's backgrounds and figure out stuff that you probably need to know. We get a lot of young guys in here that never really had an older guy to help them with the kind of daily stuff, teach them basic kind of life skills that some guys don't have, and just to help people and just to get people where they need to be in life. It works. It does work. I've seen a lot of people progress and stuff like that, but we generally don't want people to be here. We want them to be out and living their own life.
Our main role is to get to know the patients, where they are now, where they see themselves in the future, where they've come from, support them to achieve their goals.
Our kind of treatment is activity. Meaningful, purposeful activity, I think, is really important to mental and physical well-being and overall well-being. Physical exercise promotes mental well-being.
I suppose we also take some time to get to know the patient, to find out what activities they've taken part in the past, what they maybe want to do in the future, and we will start to build our treatment plan through that, and the ways to build their confidence and to take part in activities that they haven't done for a long time.
There is an understanding that activity
is paramount to
somebody's
recovery.
To people's recovery. Yeah.
Relatives are very much important for recovery of our patients. It shows the patients that there is support out there when they do go and get discharged into the community, that they do have these supports from loved ones.
Our son came from another hospital where he'd spent many years and really wasn't doing very well. We were really pleased when our son was given a place in Surehaven because we knew it was low secure and we knew that he couldn't abscond. I think that was such a relief to us
Yeah.
because we then knew that
Managed to sleep.
our son would be safe. We have been very, very pleased with the treatment our son has received here. I think the staff are wonderful. They all work as a very integrated team. They go at our son's pace. The staff are very proactive. You know, they're always coming up. If something doesn't work, they will try something else. They'll try another route. We've been always involved in his care. They've done a wonderful job, and our son has responded really well to the way that Surehaven runs and operates. I would say he's definitely thriving, and there's still many challenges, but overall, Surehaven are doing a really great job.
We're going to tennis today with him, which, you know, before our son was admitted to Surehaven, then that was unthinkable for us to think we would be doing anything like that.
We couldn't be more grateful to everybody at Surehaven for the work that they do and the patience that they have.
Yeah.
Now our son is at the stage where he is hoping, you know, there's a sort of plan for him to leave hospital. You know, he's on that pathway now, and I think that's amazing. It is amazing. So I honestly feel really quite emotional about it, actually, about how well he has done in the past 5 years.
Yeah.
A lot of it is making them feel safe where they are. We obviously do a lot of one-to-one interactions with them. We're able to build therapeutic relationship, and we get to know our patients really well, what their likes are, what their dislikes are, and that enables us to support them the best way possible. They feel that this is their home. The patients have been in hospital for so long. You know, these tiny wee steps forward are massive for us because we put so much into it. Just even getting that tiny wee bit back is worth it.
It's about giving patients choices, you know, making sure that they are comfortable within their home environment. If patients feel safe and supported, they are then going to blossom. That sense of feeling safe and secure goes a long way.
Working in any healthcare setting, you do need to be very compassionate and caring and kind
Empathetic.
and empathetic, and I think at Surehaven we have that in abundance.
To see our patients move on and achieve.
Yeah. And even small changes are big things to our patients, and they're big things to us as well.
Mm-hmm.
I'm really proud of Surehaven and how it's actually moulding into a sort of bigger service. I'm really, really proud of all my staff. The staff are absolutely exceptional. They go above and beyond, you know, every day, provide the best care possible to our patients. That means liaising with all the different departments, helping each other out, and also supporting staff. We're currently planning a new extension. The ethos of the new extension is going to be focusing on rehabilitation. Before they go out in the community, they can then be transferred to the rehabilitation unit. Helps them and prepares them for life out in the community again. So it's going to be very, very positive for patient care, but also for patients' journey. The main thing we're hoping to achieve for any of our patients is them to leave Surehaven, you know, at the right time, but also leave Surehaven with the right care package in place so that they do thrive out in the community again.
Our daughter's getting married in a few weeks' time. Plans are being made for our son to attend the wedding. Again, that would have been unthinkable a number of years ago. And I can't thank the hospital enough for what they have put in place to facilitate this. We were actually practising the country dances in the lounge at the weekend. And I said, we do these dances with him, you know, how good will that be? You know, because it was just a laugh, you know.
We were having a laugh.
Just couldn't have seen that a few years ago.
Definitely not.
So fingers crossed for a few weeks' time and the country dancing.